Today I'm going to tell you a little bit about some data which came out of my PhD, which was focused on improving immobilization protocols in free-ranging African lions, and which was published in Conservation Physiology a little bit earlier this year. So many conservation efforts are focused on free-ranging animals. And such conservation efforts and management programs often rely on research methodologies that require the handling of animals, ranging from radio collaring to the procurement of biomedical samples for research or disease purposes, and also to the translocation of animals to other areas. Restraint is required in the case of most of these handling procedures on wild animals, especially when it comes to larger species such as elephants or rhinos and carnivore species. Although physical restraint is easy to operate, it does have several limitations, and most times in the field it is unachievable. So chemical restraint is one of the most reliable alternatives to restraining wildlife species as and when it's required. And it has become a valuable tool in wildlife conservation research and management programs. So historically, chemical restraint can be traced all the way back to when South American tribes used curare-coated arrows to immobilize animals when they were hunting for food. However, the formal documented beginning of formal chemical immobilization procedures dates all the way back to the 1950s by rangers here in South Africa. So a good example of a pioneer in this field is the late wildlife vet Tony Hartwin, who was part of a team who developed the dart gun and the darts that are still used today when animals are darted during capture procedures. This was an enormous breakthrough in animal transport, and it enabled managers and wildlife researchers to move animals from places where they were at risk from poaching, and also to move animals between game sanctuaries that at that point in time were still under development. And this research effort and its success is recorded in Dr. Hartwin's first book, which is called The Flying Syringe, which you can see there on the right. So since then, there has been a constant push to improve immobilization techniques and protocols. Chemical immobilization, although it is effective, almost always poses a risk to the animal being immobilized, and both the procedure and the immobilizing drugs used can cause both physical and physiological side effects in the animal. For example, in this picture, you can see a rhino which is being transported by being suspended upside down by its feet. Both the potent opioids and the recumbent position of the rhinos when they are darted impairs ventilation and respiration in these animals. And as unlikely as it seems, researchers actually found that this was improved when the rhinos were transported upside down like this. So in most instances, when animals are immobilized, only crude monitoring such as heart rate, respiratory rate, and in very few instances, blood pressure and blood oxygenation monitoring is conducted. However, there is an effort being made to improve the monitoring of immobilized animals. As you can see in these pictures here on the left, there is blood oxygenation and blood pressure being monitored in rhino. The second two pictures in the middle are showing that blood color is being used as a proxy for blood oxygenation in the impala. And the final two pictures show blood pressure and blood oxygenation being monitored in an impala and an aardvark. So the improved monitoring of these animals often reveals side effects which are not apparent from basic clinical monitoring that is usually conducted during immobilizations. This improved monitoring is particularly important in species which are threatened or vulnerable, where the loss of a single animal can have a huge impact to the species. Dissemination of the findings that come out of research into this topic is also important, so that management practices and research practices can be positively updated. So our research group has put a lot of focus onto rhino, which are very susceptible to opioids and the immobilization procedures in general, and into improving their immobilization protocols. As you can see here in this book chapter, which was recently published in the Conservation Physiology textbook. But recently, the team has branched out to expand this research to other species. Which brings me to the species used in my research. So lions are listed as vulnerable on the IUCN Red List, with populations that are declining throughout Africa. There are estimates of a reduction in population for lions by about 50% by 2035 already. So free-living lions on reserves are one of the species in South Africa and in Africa in general that are quite intensely managed in order to maintain genetic integrity of populations and to control population sizes on fenced-in reserves where these animals can't move. There's still also a lot of research conducted on the species, from movement studies to human conflict scenarios and disease research. And because of this, free-living lions are routinely immobilized, which happens very often. So in an ideal situation, the drugs which are used for these immobilization procedures should cause a rapid induction, a good quality immobilization. They shouldn't cause any negative cardiorespiratory side effects, and they should be either reversible or allow for a rapid recovery of the animals. So depending on the vet involved and their individual preferences when it comes to darting, there are various drug combinations which have been used to immobilize lions. Teletamine combined with silazepam, which is commercially known as either xylitol or telazol, depending on which country you're in, has been historically favored. As it has a wide safety margin, it has very few cardiovascular side effects, but the major disadvantage of this drug combination is that it lacks a reversal agent, and recoveries in animals darted with this combination are generally prolonged. So recovery time can be reduced by combining the xylitol with medetomidine, and then partially reversing the drug combination's effects with the antagonist, which is called adipamazole. However, the addition of medetomidine to the xylitol is believed to cause cardiovascular side effects such as hypertension, bradycardia, and arrhythmias. So ketamine in combination with medetomidine has become a popular alternative drug combination used to immobilize carnivore species. It does have a shorter recovery time than the xylitol-medetomidine combination, but the cardiovascular side effects caused by this combination are similar. Another drug, butorphanol, has been used in combination with other drugs to produce a safer immobilization for animals by reducing the adverse effects of each drug, which it does by reducing the dosage of each drug required in the combination and relying on synergism between the drugs to achieve immobilization. So a combination of ketamine, butorphanol, and medetomidine has been used in smaller felid species such as serval and bobcats, but not in larger felid species such as lions or tigers. So there have been a few studies conducted on chemical immobilization procedures in lions, and these studies have provided some really great insights into the various drug combinations used to handle the species. However, none of these studies have really looked at in-depth physiological effects of the different immobilizing drugs and have focused more on a clinical perspective. And to date, we still have very little insight into how these immobilizations may be affecting the lions on a physiological level. The downside of the drugs used in these studies is that recovery time is still prolonged, with the exception of the butorphanol, medetomidine, and midazolam combination, which was used in this paper here to the right. This drug combination is fully reversible, but the concentrated midazolam that was used is not readily available, and the reversal agent is very expensive as well. So the aim of our study was to provide an in-depth look at how cardiovascular function differs in free-ranging African lions, which are immobilized with combinations of either xylitol medetomidine, ketamine medetomidine, or ketamine, butorphanol, and medetomidine. So for the purpose of this talk, I'm going to be referring to 3 drug combinations in particular: teletamine, xylazepam, and medetomidine, or TZM, which can be partially reversed with adipamazole; ketamine medetomidine, or KM, which can also partially be reversed with adipamazole; and finally, ketamine, butorphanol, and medetomidine, or the KBM combination, which can be partially reversed with both adipamazole and naltrexone. So for this study, all data were collected around Satara Rest Camp, which is in the Central Kruger National Park. You can see it highlighted here in red, here in South Africa. A total of 36 lions of both sexes and of varying ages and body masses were captured using a well-established call up to a bait station method, and were randomly allocated to 3 study groups of 12 lions each. Each group was darted with a combination of either xylitol medetomidine, ketamine medetomidine, or ketamine butorphanol medetomidine. So physiological variables were evaluated from 15 minutes after becoming immobilized, which we defined as when the lion became non-responsive to stimuli. And these measurements were repeated every 5 minutes for a further 30 minutes. We did measure clinical and respiratory variables as well, but for the purpose of this talk, I'm going to focus on the cardiovascular variables of heart rate and blood pressure. So an intravascular catheter was inserted into the dorsal pedal artery of each lion and secured in place. Intraarterial blood pressure and heart rate were measured using a pre-calibrated pressure transducer, which was secured at the level of the heart and zeroed to atmosphere before being connected to a PowerLab exercise physiology system and blood pressure amplifier. So the lions were weighed, their body condition and their sex was recorded, and they were aged. And at the end of each intervention, medetomidines effects were antagonized with adipamazole, and butorphanol was antagonized with naltrexone. We found that lions immobilized with all 3 drug combinations exhibited hypertension throughout the monitored immobilization. Although blood pressures did decrease by between 15 and 30 millimeters of mercury over the period, as you can see in these graphs over here. The x-axis here is indicating the sampling point, and the y-axis the measured blood pressure. The gray rectangle here indicates the expected range of blood pressures in healthy awake lions. These 2 graphs are showing mean arterial pressure and diastolic arterial pressure, and there was no difference in these 2 variables between the 3 drug combinations at any time point. Although you can see in these graphs that both of these variables were raised well above what was expected throughout the immobilization period. Systolic arterial pressure was highest in the lions which received ketamine medetomidine, which averaged around 237 millimeters of mercury at the start of the monitoring. Once again, the x-axis here indicates the sampling point and the y-axis the measured blood pressure. And the gray rectangle here is indicating that the expected systolic pressure for a healthy awake lion should range between about 140 to 150 millimeters of mercury. So the hypertension observed in our lions could mostly be attributed to the actions of medetomidine in the combinations. Alpha-2 adrenoreceptor agonists, such as medetomidine, cause vasoconstriction, which results in an increase in systemic vascular resistance. And you can see this with a concurrent increase in systemic blood pressure. So the administration of these alpha-2 agonists usually results in a biphasic blood pressure response, where you see the arterial baroreflex being activated, and then you see a decrease in heart rate and a subsequent decrease in cardiac output and blood pressure. But lions in this study didn't exhibit this biphasic blood pressure, which may have been due to sustained vasoconstriction caused by the medetomidine. This has been recorded in domestic dogs before, so it is possible that it occurred in our lions as well. It's also possible that the prolonged hypertension may have been as a consequence of some pathomimetic effects of ketamine and teletamine. These drugs block the reuptake of noradrenaline, which results in an increase in circulating catecholamine levels and also an increase in their effects on the heart. The higher hypertension of the lions at the start of the immobilization compared to at the end of the procedure could have occurred as a consequence of an excitement-induced stress response due to stimulation that was caused by a feeding frenzy on the carcass. This may have led to an increase in sympathetic drive and an increase in systemic blood pressure that we saw. The decreased drug effects over the immobilization period may also have been due to metabolism and redistribution of the drugs, which could have explained why this dropped over the 30-minute period, irrespective of which combination was used. So despite blood pressures being elevated well above what we would expect for a healthy awake lion, the heart rates of lions were mostly within reported ranges throughout the immobilization period in all three groups, as you can see here indicated by the gray rectangle. So although they were still within normal ranges, the heart rates did also decrease over the period by between 2 to 4 beats per minute, likely once again due to metabolism and redistribution over of the drugs over time, and also due to a decrease in sympathetic drive following that feeding frenzy and the excitement-induced stress response, which I mentioned earlier. So that these heart rates were within normal ranges was a bit of an unexpected finding in this study. Alpha-2 agonists, particularly medetomidine, are known to cause bradycardia and bradyarrhythmias. And we also would have expected to see a baroreflex decrease in heart rates following the hypertension. And we think what might have happened here was that this could be explained by the sympathomimetic effects of ketamine and teletamine again, once again countering this baroreflex decrease in bradycardia and resulting in normal heart rates. So even though the heart rates of the lions remained within expected limits throughout the immobilizations, some of the lions in each group did experience skipped heartbeats, which resulted in arrhythmias. We believe that these were atrioventricular blocks, in which impulse conduction from the atria to the ventricle was delayed or interrupted. But in this study, we didn't conduct an electrocardiograph and the arrhythmias were diagnosed morphologically from the blood pressure traces. And we couldn't classify these AV blocks to degree level. So at the top of the slide here, you can see a blood pressure trace from one of our study animals, where each of the arrows indicates a skipped heartbeat. The skipped heartbeats were observed in about 16 out of the 36 lions that were used in this study. And those that were immobilized with the TZM combination had a higher prevalence of these skipped beats, with 66% of the lions in these groups exhibiting them, while those in the KBM group had a lower prevalence, with only 25% of lions in that group exhibiting these skipped heartbeats. In the animals where these skipped heartbeats did occur, there was no difference in the frequency of the skipped beats or the number of normal heartbeats between the skipped beats between the different drug combinations. And the finding of these AV blocks in lions immobilized with all three drug combinations with no difference in pattern implies that medetomidine, which was the common agent in all three drug combinations, was likely responsible for these skipped heartbeats. Vagal-induced arrhythmias like first and second degree atrioventricular blocks are commonly reported side effects of these alpha-2 agonists. So our results did confirm that teletamine, cilazepam, and medetomidine, or ketamine, medetomidine, and ketamine, butorphanol, medetomidine, were all effective drug combinations for the immobilization of free-living lions. However, we did find clear benefits to support the use of the KBM combination over the other two combinations, including less severe cardiac side effects, which were less severe hypertension than the ketamine medetomidine combination, and fewer skipped heartbeats than the xylitol medetomidine combination. Although I didn't mention it in this talk, the KBM combination also significantly reduced recovery times in the lions, as well as the amount of ataxia that we saw during recovery was less, which is an added benefit to this combination. So we also saw in the study that drug combinations that are commonly used to immobilize lions may cause these negative cardiac side effects, which have not been previously reported, despite the widespread use of these drugs. We also saw that animals may be negatively impacted despite immobilizations appearing to be uneventful based on visual and basic clinical determination. So most studies monitor heart rate, but not blood pressure. And as we saw previously, based on this, all of our immobilizations would have been deemed to have been good, when actually all of the study lions were severely hypertensive. So the cardiovascular side effects that we saw with these three drug combinations were clinically the most concerning outcome of the immobilizations. And further investigation into both their mechanisms and their consequences are needed. So based on our findings, the KBM combination produced the least severe cardiovascular side effects in these free-living lions. But the negative effects that did occur with this combination do still need to be addressed. So although the hypertension was severe, we don't know if it actually has a clinical consequence in these animals. And by the time we had antagonized the immobilizing drugs in these lions, all of the lions were still severely hypertensive. And we have no way of knowing if and for how long after recovery the hypertension may have persisted. The use of conventional techniques which are used during immobilization doesn't allow for the determination of blood pressure in animals that are recovering. And it might be useful in future studies to determine just how quickly this blood pressure does fall to normal during recovery. This could be achieved using biologging, using implantable blood pressure sensors. However, this does add the complication of having to do surgery on these animals and having to recover the data afterwards. Future studies on these lions should determine the clinical relevance of these cardiovascular side effects, as well as the mechanisms which are actually causing them. Such studies could look at potential drugs that could be used to either prevent or reverse these side effects during the immobilization procedure. And there are certain drugs which may be good candidates for this purpose. One such drug is vatinoxin, which is a peripheral alpha-2 antagonist. It has a limited ability to cross the blood-brain barrier, and when it is administered along with alpha-2 agonists such as medetomidine, it doesn't influence the quality of the sedation or the muscle relaxation in the immobilized animal, but it does lessen the adverse cardiovascular effects that we saw, as has been determined in a few herbivore species and also domestic species such as dogs. So improving these immobilization protocols will not only improve the welfare of individual lions, but will have a direct conservation consequence for the species as a whole. Using the safest chemical capture protocol as a management tool will hopefully contribute to future conservation efforts of lions as a whole, as a species. An improved understanding of the physiological effects of each drug combination may allow for the development of a chemical capture protocol that reduces the associated morbidity and mortality risks in lions when they are immobilized. And as you can see from our results, this is a step forward in the right direction, but there is still a lot of research that needs to be done to make these procedures as safe as possible for both researchers, for managers, and for the animals involved. So we do need to get onto that to make it a bit safer. Thank you very much. Are there any questions?